A jab of cabotegravir after every 2 months can help reduce the risk of getting HIV in sexually active women, according to clinical data from trials which have been conducted in Zimbabwe since 2018. Zimbabwe is among 6 sub-Saharan Africa countries that have been conducting the clinical trials, with over 3,000 women from the region, including 800 from Zimbabwe, undergoing trials. We tracked some of the women who were part of the clinical trials conducted by a team of experts from the University of Zimbabwe and its partners.
For every drug to be introduced, it needs people who volunteer to say, okay, I'm volunteering for this drug to be tested on me. Even other drugs that are already being used now, they've been trials before. So I said, no, why not? Let me just volunteer and make a difference. At least something that I would have done. I've been given a chance to be in the trials that will make a difference to me and the community. Honestly speaking, I was actually afraid because you know this thing of being elaborate, and you'll be like, what happens if I take the tablets? Initially, it was the tablets. What if something happens to me?
I was a young woman at risk of getting infected. So when the community health workers came scouting for young women at risk of getting infected, I said, this is the chance for me. I only got to know about the side effects when I read the consent papers, because there are papers that you sign first. It was a list of side effects, but when they go through those side effects, they will tell you it depends on your body, how your body functions. You might not get this, you might not get that. We are different. So I was a bit scared at first, but when they went through the consent papers, I was fine.
By the time I joined this trial, I remember that time I was dating an HIV-positive partner. So the moment those ladies came telling us about the trial, I think it was an opportunity for me, since I had an HIV-positive partner by that time. I started in, I think, January 2018. I didn't have any side effects.
Principal investigator from the University of Zimbabwe, Dr. Nyaradzo Mgodi, is excited about the groundbreaking clinical research.
So we were looking at preventing HIV. So when you want to prevent a disease, you prevent a disease in those who are at risk for that disease. So we worked with women who medically we felt that they were at risk for HIV. And after following them up, we showed that cabotegravir was 9 times as efficacious as Truvada.
Director at the University of Zimbabwe Clinical Research Center, Professor Travahera Chirenje, stressed the importance of clinical trials.
And we cannot afford that a drug is manufactured and we give it straight to human beings. So we need data, local data in Zimbabwe and other countries, to make sure that the drug is safe and drugs works for the indication we're testing it for. For this cabotegravir, which was given intramuscular, we're testing it to make sure that it prevents HIV. Moreover, we also wanted to know that it's safe to give it, so we'll be monitoring people who are in the trial to make sure that it's safe to give the drug. Then we take that dossier, we take those data that we get to the Medicine Control Authority of Zimbabwe, and they look at it to make sure that it's safe and indeed it's protecting the indication that is going to be registered under. So that's the importance of a clinical trial.
Given a choice between the daily pill, which is already in use, and the cabotegravir injection, all the ladies interviewed by ZBC News prefer the injection.
I'll take the injection because I don't have to remember that every time, I don't have to skip my tablets, because you have to be consistent. You know that if I'm taking them at 8, I have to make sure that I have to. But with an injection, I know that for the next 8 weeks, I'm covered.
When they're testing these drugs, they want to see which drugs works. We have different lifestyles, so they want to see which drugs works for every woman. So I urge all women, even if you're not at risk, I think you should try this. You should go for it. PrEP is there. PrEP is working. I am a testimony of PrEP.
I would prefer the injection because it's not easy taking the pill every day. I feel having one dose of the injection once every 2 months is better. Because with the pill, there are chances that you may forget.
Based on World Health Organization WHO recommendations, the cabotegravir may be offered to people at substantial risk of HIV infection once in 2 months as part of a comprehensive HIV prevention approach. Zimbabwe is the first African country and third in the world after the USA and Australia to approve the drug. Abigail Tembo, ZBC News, Harare.